Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're focusing on a very specific seasonal allergy that hits hard in late summer and fall, short ragweed. For many patients, ragweed season is far more than a few sneezes. It can mean weeks or even months of stuffy, runny, or itchy nose, and itchy and watery eyes that interfere with sleep, school, work, and daily life. Most patients try to manage the season with a familiar toolbox, an oral antihistamine, a nasal spray, sometimes ice drops, but still feel stuck taking multiple medications that mainly control symptoms without changing the underlying allergic disease. Ragwitek offers a different approach. It is the first and only FDA-approved sublingual immunotherapy tablet for short ragweed allergy, designed to desensitize the immune system to ragweed pollen itself. After the first supervised dose in the office, it is taken once daily at home, started before the season, and continued throughout, with the goal of building immune tolerance and reducing allergic response when pollen counts are high. In other words, it shifts treatment from reacting to symptoms to addressing the allergy at its source. So, what should you know about Ragwitek? In this episode, I'll walk you through 5 key things: its indication, how it works, how to take it, important warnings and precautions, and its side effects and safety. If you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Ragwitek and who is for? Ragwitek is a once daily sublingual immunotherapy tablet made from standardized short ragweed pollen extract. It's FDA approved for the treatment of short ragweed pollen induced allergic rhinitis with or without conjunctivitis in patients ages 5 through 65. Before starting Ragwitek, patients must have objective confirmation of short ragweed allergy, either through a positive skin test or blood testing showing short ragweed specific IgE, the antibody that drives allergic reactions. Ragwitek was first approved in April 2014 for adults 18 and older. In April 2021, the indication expanded to include children and adolescents ages 5 to 17, extending the disease-modifying option to younger patients affected by ragweed seasons. Second, how does Ragwitek work? In short ragweed allergy, the immune system mistakenly identifies short ragweed pollen as harmful substance. That initial exposure leads to the production of IgE antibodies, creating an allergic memory. With subsequent exposure, short ragweed pollen allergens bind to IgE on mast cells, triggering histamine and other inflammatory mediators that cause sneezing, congestion, runny nose, and itchy eyes. Ragwitek, a form of allergen immunotherapy, works through a process called allergy desensitization. Instead of blocking symptoms after they occur, it delivers carefully controlled daily doses of short ragweed allergen under the tongue. There, specialized immune cells capture and process the allergen and gradually retrain the immune system to respond differently. With repeated exposure over time, reactivity to short ragweed decreases while tolerance increases. Clinically, this translates into fewer symptoms during the season and reduced reliance on daily symptom relief medications. It's important to remember that Ragwitek is not a rescue medication. It is a disease-modifying therapy intended to change how the immune system responds to ragweed exposure. Third, let's talk about how to take Ragwitek. Ragwitek is taken once daily as a sublingual tablet. After removing it from the blister package with dry hands, the tablet is placed immediately under the tongue and allowed to dissolve completely, usually within about 10 seconds. Do not take Ragwitek with food or beverage. Patients should avoid swallowing for at least 1 minute and should not eat or drink for 5 minutes after administration. Hands should be washed after handling the tablet. The first dose must be given in a healthcare setting under the supervision of a doctor experienced in allergy diagnosis and treatment, followed by at least 30 minutes of observation to monitor for severe local or systemic allergic reactions. If tolerated, subsequent doses may be taken at home. In children, each dose should be administered by an adult who can observe for any symptoms of an allergic reaction. Timing is critical for Ragwitek. Treatment should be started at least 12 weeks before the expected onset of Ragweed season and continue throughout the season. If a dose is missed, do not take a double dose and just take the next dose at the usual scheduled time the next day. If more than one dose is missed, patients should contact their allergy specialist before restarting. In clinical trials, interruptions of up to 7 days were allowed, but safety data beyond that are limited. Because severe allergic reactions can occur, all patients taking Ragwitek must also be prescribed an epinephrine product and trained along with caregivers when appropriate on when and how to use it. Fourth, let's review the warnings and precautions. As an allergen immunotherapy, Ragwitek can cause serious systemic allergic reactions, including anaphylaxis. It can also cause severe local reactions in the mouth and throat, which in rare cases may compromise the airway. Although uncommon, these reactions may be life-threatening. Patients should stop Ragwitek and get medical treatment right away if developing any of the following symptoms, such as trouble breathing, throat tightness or swelling, trouble swallowing or speaking, dizziness or fainting, rapid or weak heartbeat, severe stomach cramps or pain, vomiting or diarrhea, severe flushing or itching of the skin. Persistent or worsening mouth or throat symptoms should also prompt drug discontinuation and clinical assessment. Because of these risks, all patients must have access to an epinephrine product and know exactly when and how to use it. If epinephrine is administered, patients should seek immediate medical care and stop Ragwitek until further evaluation. Patients with a history of any severe systemic allergic reactions or any severe local reaction to sublingual immunotherapy should not take Ragwitek. Furthermore, Ragwitek may not be appropriate for patients with markedly reduced lung function, severe mast cell disorders, or significant cardiovascular diseases, including recent heart attack, unstable coronary disease, uncontrolled hypertension, or serious heart rhythm problem. These conditions may increase risk during a severe allergic reaction or limited safe use of epinephrine. Patients taking medications that interfere with epinephrine may also not be good candidates. Eosinophilic esophagitis is another important consideration that has been associated with sublingual immunotherapy. Ragwitek is contraindicated in patients with a history of eosinophilic esophagitis. If patients develop persistent swallowing difficulty or chest pain, Ragwitek should be stopped and further evaluation pursued. Asthma control also matters. Ragwitek should not be taken during an acute asthma exacerbation, Patients with severe, unstable, or uncontrolled asthma should not start therapy. Lastly, Ragwitek should be paused in the presence of active oral inflammation or oral wounds, including ulcers, infections, cuts, or after recent dental procedures, until the mouth has fully healed. And finally, let's review side effects and safety. In adults, the most common side effects reported in clinical trials were local reactions involving the mouth, throat, and ears, including mouth, tongue, or ear itching, oral tingling or abnormal sensation, mouth swelling, and throat irritation. Drug discontinuation due to adverse reactions occurred more often with Ragwitek than placebo, 4.4% versus 0.8%, most commonly due to mouth swelling, swollen tongue, or difficulty swallowing. Serious systemic allergic reactions were rare. In adult trials, one patient, about 0.1% of treated patients, experienced a treatment-related severe systemic allergic reaction that led to drug discontinuation. Symptoms begin as local reactions on day 1 and progress by day 6 to include throat swelling, difficulty breathing, nausea, and lightheadedness, with full recovery after self-administered epinephrine plus additional medications. In children and adolescents ages 5 to 17, the safety profile was similar. Most side effects were local reactions affecting the mouth, throat, and ears, including ear or mouth itching, swelling of the lips, tongue, uvula, or throat, mouth or tongue ulcers or sores, pain in the mouth, throat irritation, nausea, and upper abdominal pain. Drug discontinuation rates were again low but higher than placebo, 3.9% versus 1%, with throat irritation being the most common reason for stopping. A small number of pediatric patients experienced treatment-related systemic allergic reactions, and one patient, 0.2% of treated patients, had an epinephrine-treated event. Severe laryngitis during the Ragweed season that require hospitalization and treatment with inhaled epinephrine, with resolution in 2 days. Post-marketing reports have included tongue pain, swelling, and voice changes. Because these events are reported voluntarily from a population of uncertain size, it is difficult to estimate how often they occur or establish a causal relationship to drug exposure. However, they reinforce an important point. Any new, persistent, or escalating symptoms, especially involving the mouth, throat, swallowing, or breathing, should prompt stopping the tablet and contacting the treating doctor. Overall, Ragwitek has a well-defined safety profile. Most patients experience mild to moderate local reactions, while serious reactions remain uncommon. And there you have it, 5 key things to know about Ragwitek, the first and only FDA-approved sublingual immunotherapy tablet for short ragweed pollen allergy. By targeting the underlying source of allergic inflammation, rather than simply suppressing symptoms, Ragwitek offers a disease-modifying option. With appropriate patient selection, epinephrine preparedness, and close clinical monitoring, it can be used safely and effectively. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.